Hello friends, today we will discuss about aortic arch and vascular rings, their prenatal diagnosis and significance. Let's discuss little about embryology. In developing heart tube, bulbous cordis is cranial most part. It is divided into three parts: proximal one-third, middle one-third and distal one-third. Distal one-third is called truncus arteriosus. Truncus arteriosus is continuous distally with aortic sac. Aortic sac is continuous with right and left pharyngeal arch arteries by right and left horns. These arch arteries turn backwards and continues with right and left dorsal aorta. Dorsal aorta remains paired but caudal in the region of arches, but caudal to this they fuse to form single descending aorta. Major arteries of head, neck and thorax are derived from these arches. Now in embryonic arterial system, caudal side of each of the ventral aorta fuse to connect with ipsilateral dorsal aorta via 6 pairs of primitive arches. First, second and fifth arch later disappear and third, fourth and sixth arch only left. Third and fourth arches are retained to form double aortic arch system with symmetrically arranged bilateral brachiocephalic arteries. Sixth arch arteries form pulmonary arteries and ductus arteriosus. There is double aortic arch in embryo where ascending aorta splits into right aortic arch and left aortic arch, which merge to form descending aorta located in central position anterior to spine. In addition, left and right pulmonary arteries are connected to respective arches by left and right ductus arteriosus in region of subclavian arteries. Normal and abnormal development of aortic arch branching is related to which side of left aortic arch or right aortic arch regresses or persists during the development. Then why we are worried to check arches and what are the type of arches? They can be left aortic arch with ursa, right aortic arch with right ductus, right aortic arch with left ductus, right aortic arch with ulsa. They can be double aortic arch, vascular ring or pulmonary sling. Left aortic arch is most common arch which we see in fetal heart. Here there is regression of right aortic arch beyond the origin of right subclavian artery, resulting in persistence of left aortic arch, with first branch as right brachiocephalic, second left common carotid artery, then left subclavian artery. Left ductus arteriosus persists and right ductus arteriosus regresses. Here we can see aortic arch and ductal arch both are forming V sign on the left side of the trachea. In left aortic arch with ursa, there is partial regression of right aortic arch between the origin of right common carotid artery and right subclavian artery, resulting in persistence of left aortic arch with first branch is right common carotid artery, then left common carotid artery, then left subclavian artery, and last branch is aberrant right subclavian artery. This ursa goes behind the trachea to the right side of the arm. Left ductus arteriosus persists and right ductus arteriosus regresses. URSA is important because it is associated with increased risk of trisomy 21 and microdeletions. It is also associated less commonly with trisomy 13, 18 and Turner syndrome. Other cardiac malformations can also be associated. It can cause pressure on esophagus resulting in dysphagia, dysuria. In isolated cases, association with trisomy 21 is weak. URSA is best detected in 3-vessel trachea view with low velocity color Doppler. Azygous vein can be confused with URSA, for which spectral Doppler showing arterial waveform in URSA can be helpful. In right aortic arch with right ductus, what is there? There is regression of left aortic arch beyond the origin of left subclavian artery, resulting in persistence of right aortic arch with first branch as left brachiocephalic, then right common carotid, then right subclavian artery. Right ductus arteriosus persists and left ductus regresses. In grayscale, in four-chamber view, we can see descending aorta on right side. This is most important diagnostic point. Here in three-vessel trachea view in color Doppler, we can see right aortic arch and ductal arch both are forming V sign on right side of trachea. In some of associated cardiac malformation, it is often difficult to demonstrate the exact cause of ductus arteriosus as right pulmonary artery is hidden under the aortic arch and right aortic arch is seen as single large vessel. Mostly right aortic arch is associated with conotruncal anomalies in more than 90% of cases. Common ones are TOF, pulmonary atresia with VSD, CAT, absent pulmonary valve syndrome, tricuspid atresia, and DORV. Extracardiac and chromosomal anomalies more commonly associated are 22q11.2 microdeletions, trisomy 21, and other aneuploidies. Here we can see in three-vessel trachea view, both ductal arch and aortic arch are forming V on the right side of the trachea with antigate flow in aortic arch and reversal in ductal arch. Right aortic arch with left ductus can also be there. In it, there is regression of left aortic arch between left common carotid and left subclavian artery, resulting in persistence of right aortic arch with first branch as left common carotid artery, second is right common carotid, third is right subclavian artery, and terminal is aberrant left subclavian artery. Here, right ductus arteriosus regresses and left ductus arteriosus in the region of left subclavian artery persists. In grayscale, we can see there is descending aorta on right side. And in three-vessel trachea in color view, we can see a U-shaped ring is seen with ductal arch coming from left side and aortic arch from the right side. Color Doppler can easily demonstrate U sign and in almost all cases there is aberrant course of left subclavian artery. Sometimes ulcer arises directly from descending aorta through arterial conduit called femoral diverticulum. Three-vessel trachea view shows left-sided ductus, posterior femoral diverticulum, and right-sided aortic arch. These all three form a U-shaped ring. Origin of ulcer from femoral diverticulum is shown in coronal plane through proximal descending aorta. Here you can see in tautology of Fallot, a U-shaped ring is seen with antigate flow in both ductal arch and aortic arch. And here in pulmonary atresia, we can see U-shaped ring with reversal in ductal arch and antigate flow in aortic arch. In fetus A, we can see it is a normal thymus with a U-shaped ring. Here, no chromosomal abnormality was detected in fetus. But in this fetus, this thymus is hypoplastic with both aortic and ductal arches are seen very close to sternum. Chromosomal abnormality detected was 22q11.2 microdeletion. Right aortic arch can be seen in early gestation, like here we can see in 13 weeks there is U-shaped ring behind the trachea. At 12 week also we can see in U-shaped ring. In 13 week again U-shaped ring is seen behind the trachea. Here it is right aortic arch with right ductus arteriosus forming a right V sign on the right side of trachea. Again in top we seeing at 12 weeks there is right aortic arch seen as single large vessel with right ductus is hidden behind the right aortic arch. Now what is strategy of diagnosis of aortic arch anomalies? If a V configuration presents in three-vessel trachea view, any of the four situations exist. They can be left aortic arch and left ductus arch if there is left V. They can be right aortic arch, and right ductus arteriosus if there is right V. They can be V along with left V along with aberrant right subclavian artery, or they can be right V along with aberrant left subclavian artery. URSA and ULSA can also be seen in, although they seen in 3-vessel trachea view, they can be seen in additional coronal scan. If a U-shaped structure appears in 3-vessel trachea view, it indicates that arch and ductus are located on either side of trachea. Usually it is a right arch and left ductus. Diagnosis of mirror image branching of right aortic arch can be confirmed by leftward coursing of vessels arising from the aorta to be the left brachiocephalic. In double aortic arch, there is persistence of both right aortic arch and left aortic arch with with common carotid and subclavian arteries on both sides arising from their respective arches. Here, aorta is dividing ventral to trachea on both left as well as right branch and forming a complete ring around the trachea. Aortic arch has posed to right side of trachea, but at the level of trachea, it bifurcates directly to have one arch to the right and one to the left in lambda configuration. Left arch is narrower than right and can be hypoplastic. Compression of trachea at anatomic level of bifurcation into both bronchi can be seen in longitudinal view of neck. Here it is normal trachea. Here we can see compression of trachea at the level of bifurcation in the coronal view. Now differential diagnosis. Right aortic arch should be differentiated from isomerism. Isomerism is often accompanied by other markers like AVST, anomalous pulmonary vein, abnormal venous connection, and abnormal vessel arrangements. Right aortic arch and U sign should be differentiated from double aortic arch. For this, check in higher oblique plane for possible bifurcation of aortic arch ventral to trachea in right and left branches. Also check for compression of tracheal lumen in coronal view. Additional coronal scan is needed to see symmetrical origin of bilateral brachiocephalic arteries to differentiate between double aortic arch with hypoplastic left arch and right aortic arch with left brachiocephalic artery. This is important because double aortic arch needs surgical repair postnatally as it creates tight vascular ring as compared to right aortic arch with U sign which creates loose vascular ring. Now what is the importance of prenatal diagnosis of fetal vascular rings and slings? A vascular ring or sling can present when vessel in upper mediastinum encircle and compress trachea or esophagus. With some severe rings like double aortic arch, sign and symptom of trachea compression often present in early infancy. Postnatally, vascular rings are often mistaken for upper airway pathologies and missed unless specifically looked for. Accurate prenatal diagnosis helps to improve diagnosis as it enables proper timing of surgery or auxiliary ventilation after delivery. Delayed diagnosis can result in significant damage to upper airways from persistent compression. As ductus turns into ligament, it is more difficult to visualize postnatally. Bronchoscopy also can diagnose tracheal compression in more than 70% of cases of right aortic arch that were prenatally diagnosed. In addition, fetal detection of these abnormalities might serve to support chromosomal examination or detailed fetal echo to screen for congenital heart disease. Now, what is pulmonary artery sling? In case of pulmonary artery sling, left pulmonary artery originates from right pulmonary artery and travels between trachea and esophagus to reach left lung, hilum. Distal trachea and right mainstem bronchus compression is always present in this malformation. In ultrasound, 3-vessel trachea view is usually normal with no additional vessel seen behind the trachea. Mechanical ventilation is very difficult postnatally depending on airway compression. Surgical repair involves tracheoplasty with reimplantation of left pulmonary artery anterior to trachea. While concluding, I want to say that aortic arch anomalies, vascular ring, and pulmonary slings can be fully assessed on fetal echo. Four-chamber view to be checked for position of descending aorta. It is necessary to scan the root of great arteries in three-vessel view and then move gradually cephalad to get detailed information of origin of left pulmonary artery from right pulmonary artery and its way to the hilum of left lung behind trachea in cases of pulmonary sling. When scanning from three-vessel view up to three-vessel trachea view, trachea should be recognized and used to determine the position of aortic arch. When vessels are identified behind trachea, one should consider possibility of vascular rings or slings. Cornal plane is useful for showing abnormal configuration of proximal descending aorta in posterior mediastinum. And last but not least, next morning when you see the fetal arch, never forget to see aortic arch, vascular ring or slings. These are the references from where I have taken the content. And thank you for your patience listening.